This is my presentation on assisting and advocating for greening the ghetto. Greening the ghetto. The South Bronx is the focus of greening the ghetto. Greening the ghetto centers around the urban industrial waterfront communities that are surrounded by toxic public infrastructure, water pollution control plants, waste transfer stations, energy facilities, and heavy manufacturing facilities. The significant maritime and industrial areas are located in environmental justice communities which are low income and largely communities of color. Not only does the zoning policies pose a risk to the health of the surrounding communities, but also the neighboring communities that are upland due to potential storm surges and sea level rises. One job of the health promotion specialist is to advocate for healthy policy changes. This discussion will present a community needs and a community assets map to determine the strengths and challenges the community faces, as well as critical health issues. The discussion will then examine the community mobilization efforts to address the issue and how my role as a representative from the health department can assist in future mobilization efforts. The community needs map. These needs were included in a map to give a picture of the living conditions of South Bronx, which led to health risks of the community. Substance abuse, pollution, unemployment, slum housing, asthma, and HIV/AIDS. I assess these needs because unemployment. There is evidence that socioeconomic status and human health are directly related. Pascal notes that many interrelated factors dictate the relationship between income and health, including socio-political status, access to and quality of health care, health literacy, nutrition awareness, stress management, and exposure to environmental hazards. South Bronx is the poorest congressional district, and 20% of the residents are unemployed, with over 1/3 living in poverty. Another needs, pollution. There are 9 waste transfer stations in South Bronx, which causes heavy environmental burdens on the surrounding communities. There are also other industrial and polluting land uses, including the Hunts Point Cooperative Market, Wholesale Food Distribution Center, which is the largest in the world, power plants, and extremely heavy industrial truck traffic that all contribute to the environmental hazards of the community. Asthma. Asthma is among the most significant health concerns, with causation commonly attributed to indoor mold, cockroaches, rodents, and outdoor exhaust environmental conditions. HIV/AIDS is the 4th leading cause of premature death and accounts for 30% of all related deaths in New York City. Substance abuse. In 2012, an estimated 639.2 per 100,000 emergency room visits in New York City were due to non-alcohol illicit drugs. Slum housing. History of housing degradation and misery for the residents of South Bronx community. The community assets map. These assets were added to the map to show the organizations and community involvement, as well as the states in advocating for the better and improvement of South Bronx. Included are the New York City Environmental Justice Alliance, which is a nonprofit membership-driven network, nonprofit or public agencies and community-based organizations, the Bronx Environmental Stewardship Training Program, academic partners, and South Bronx Environmental Justice Partnerships. The broken lines are primary building blocks, which are assets and capacities in under neighborhood control. The gray boxes represent secondary building blocks. These are assets in the community controlled by outsiders. The plain white box are potential building blocks. These are resources outside the neighborhood and are also controlled by outsiders. The community assets, housing. Approximately 78 nonprofit or public agencies and community-based organizations provide housing services of various types located in the Bronx. Job training and placement. The Bronx Environmental Stewardship Training Program employs the most difficult to hire citizens. Academic partners. The Pratt Institute provides technical assistance to develop policy recommendations. The New York City Environmental Justice Alliance is a nonprofit membership-driven network linking grassroots organizations from low-income neighborhoods and communities of color in their struggle for environmental justice. The South Bronx Environmental Justice Partnership. This is made up of a consortium of academics, health professionals, community leaders, and government entities representing diverse organizations, including biomedical research-based institutions, Montefiore and Einstein, public universities, Lehman College, and CUNY, and the Grassroots Community Organization for a Better Bronx, funded by the National Institute of Environmental Health Services. The strengths and challenges. The strengths of the community are the support of organizations and community leaders in advocating for better zoning laws and environmental justice. The challenges that the community faces are the zoning laws that allow the placement of waste and other polluting facilities in the community to operate at higher environmental standards. Critical health issues. The most critical health issues the community faces are asthma, which contributes to a childhood asthma hospitalization rate 7 times the national average. The strengths of the organizations, such as the South Bronx Environmental Justice Partnership, New York City's Environmental Justice Alliances, and community-based advocacy groups are working on resolving critical health issues, although there is much work to still be done. Community mobilization. The first thing the community did was to recognize that there was an issue with the waste and industrial facilities that were polluting the South Bronx. The concerned citizens of the community joined together with the support of other established organizations and organized the people to pursue better health conditions for their community. The community was assessed and was found to be the poorest congressional district in the country, with high rates of unemployment, slum housing, predominantly communities of color. The organizers then determined their priorities and set goals of revitalizing the South Bronx, such as with the Greening the Ghetto project, and advocating for changes in environmental laws and zoning laws. The outcomes of the actions led to the training of people to install and maintain green roofs and safely clean up contaminated lands left in their neighborhoods by negligent industry. Pascal noted that after rallying the community, securing government support, and implementing various programs, diverse members from the community were on the ground rebuilding the Bronx from the ground up, park by park, tree by tree, and now has an elaborate network of parks connected by greenways, bike paths, and pleasant walkways, proudly attracting visitors from the other boroughs. Assisting the community in future mobilization. The health issue that can most effectively be addressed is the effect of the air pollution and its contributing factor to respiratory related illnesses such as asthma. The needs and assets map can be applied according to the needs of the community concerning the rate of asthma and pollution and the assets of the many resources, organizations, and community support that are working together for changes. The community should loop back and continue to address issues by organizing and building support with policymakers and local officials to work for environmental justice. As a representative of the health department, my role in the community's future mobilization would be to gather data on the effects of the air pollution and its contributing factors to healthy living. I would then join with the community organizations and advocate for policy changes that will effectively promote a healthy environment. In conclusion, the Greening the Ghetto project was aimed to bring awareness to the health issues that are affecting the low-income, predominantly communities of color by major environmental polluting hazards. With the assessment of the community needs and assets, community organizers were able to join with stakeholders, politicians, and other established organizations to promote and provide changes to better the community. As noted in Pascal, the Greening the Ghetto movement has been gaining traction, addressing the need to restore the beauty, health, and dignity of the Bronx and its people after decades of neglect, pollution, and degradation.